Hello, my name is Peter. I'll be your nurse practitioner today. And what is your name?
Ashley Tomasevic.
Hi, Ashley. Welcome to our clinic. And I will be examining you today and asking you interviewing questions regarding your health history and your current problem that you have. Do you mind if I have a seat?
Go ahead.
Okay, thank you. I would like to start by asking you for your full name.
Ashley Tomasevic.
Okay. And how do you prefer to be called?
Ashley's fine.
Ashley's fine. Okay, great. Thank you. My name is Peter. Like I said, I'll be your nurse practitioner, and I will be asking you some questions. Some of them might feel a little intimate, and if you're not comfortable answering them, please let me know.
Okay.
Okay. So, what brings you here today?
I'm having some right knee pain.
Right knee pain. Okay. And are you hurting right now?
Just low level.
Okay. How would you rate that pain that you're feeling right now?
About a 2 out of 10.
2 out of 10. Okay. And you said your pain started about
2 weeks ago.
2 weeks ago. Okay. And did the pain change at all? Did it get better or worse? Or did it stay the same?
It gets a little worse in the evenings
Okay.
when I've been on my feet or if I exercise. Maybe up to a 5.
Okay.
It will reach, but it's been pretty consistently in that range for the past 2 weeks. It's
Great.
not getting better.
Thank you. And have you taken anything for it? Any, icing or elevations or
I do
over the
ice it
counter?
and elevate it when it really hurts.
Okay.
And I will take Motrin.
Okay, very good. You take 1 or 2 pills of Motrin?
2.
2. Okay. And does that help? Does it make a difference for you?
It does. It will take it down to a 1 or 2.
Okay, very good. And you said it started 2 weeks ago. Do you remember doing something, falling, or
I was just
stepping
walking on
awkwardly?
a treadmill, walking. I do
Okay.
that most days for about 3 miles, and nothing happened. I didn't feel any pain. I didn't notice an injury. It's just after I was done, it hurt.
Got it. And you haven't noticed any bruising or swelling or anything like that?
No.
Okay, well, thank you. I'm sorry to hear that you're dealing with this. I'll do my best to help you. In order to know you better, I'm going to ask you a whole bunch of questions, and I would like you to tell me a little bit more about yourself. How old are you, Ashley?
I'm 48.
48. And what is your date of birth?
10/14/75.
1475. Are you married?
Yes.
You have kids?
Yes, I have 2 boys,
Okay, how old are they?
6 and 8.
6 and 8. And what do you do for a living?
I'm a social worker in the medical field for a
Okay.
dialysis provider,
Very nice. And are you full-time or part-time?
full-time.
And your husband, does he work?
Yes,
Okay, what does he do?
he's a nurse.
He's a nurse. Okay. And do you live in a house or an apartment?
We live
or-
in a house.
You live in a house. Okay. Do you have any pets?
We have a dog.
You have a dog. Okay, that's very nice. Can you tell me if you have any allergies?
No.
No allergies. Okay. No allergic to medications or to environmental allergies?
Nothing
Food?
I'm aware.
Okay, great. And I'm going to ask you a little bit more about your social history. Are you a smoker? Do you smoke? Use
No.
tobacco products? No. Do you drink alcoholic beverages?
Just socially, maybe 1 to 2 drinks a week.
Okay, very good. And when you say 1 to 2 drinks, would that be a bottle, a cup?
A can of beer.
Can of
like
beer,
a
okay.
Single drink.
Very good. Is your husband smoking by any chance?
No.
No, okay. Anyone in your circle of friends smoking?
No.
No, okay. Are you using any illicit drugs?
No.
Any recreational stuff?
No.
Okay. Do you take any medications?
No.
No medications at all, okay. Just over-the-counter stuff for the past 2 weeks. Okay. Very good. And I will ask you a little bit more about your health history. Do you have any diagnosis at all? Any chronic conditions?
No.
No. You've never been told you have high blood pressure or irregular heartbeat?
No.
No. Okay. You didn't have asthma as a child?
No.
Or any kind of respiratory issues? No. No abdominal issues?
No.
Constipations, diarrhea, any of that stuff?
No.
No. Okay. No UTIs or bleeding with urinations or discomfort?
No.
Any issues with your joints?
No.
No. Okay. All right. Well, any issues with mental health? Have you ever been told that you have anxiety or anything like that?
No.
No. Okay. Do you hear voices, or do you have any thoughts that may suggest that you want to harm yourself or someone else?
No.
Okay. Well, thank you for your answers. How are we doing so far? Are you comfortable?
Yes.
Okay, great, thank you. I would ask you a little bit more about your health history now, okay?
Okay.
And do you have a PCP?
Yes.
When is the last time you saw your PCP?
I had an annual visit in March.
Okay, very good. Do you have a GYN doctor?
I do.
Okay. And when is the last time you saw this person?
I saw her last in November of last year.
November. Okay. Do you do breast exams?
Yes.
Okay, good. How often?
A few times a week.
Nice. And your last mammogram was?
Also March.
March, okay. Do you have a dentist?
I do.
Okay. When is the last time you saw this person?
I had a cleaning in May.
Okay, excellent. And do you see any other specialists?
No.
No? Okay. And other than that, do you have any, are you seeing anyone that's alternative medicine or anything?
No.
Okay, good. And are you practicing any religion or a spiritual person?
Not really, no.
Okay. Okay, that's okay. And can you tell me a little bit more about your family? Are your parents alive?
Yes, they are.
Okay, and how old are they?
My dad is 79, my mom is 78.
Okay, any health issues with them?
My dad has hypertension, and my mother is healthy. No issues.
Okay, very good. And do you have any grandparents alive?
No, they have all passed.
Okay, I'm sorry to hear that. Do you know maybe the reasons for their passing or how old were they?
I can't tell you my grandfathers, they passed before I was born. My maternal grandmother died when I was very young. She was in her 60s, lung cancer.
Okay.
She smoked. My paternal grandmother was a heart attack in her 70s.
Very good, thank you for that. And do you have any siblings?
I have one brother.
Okay, very good. And does he have any health history?
No.
Issues? No. Okay. And as far as you told me that you're exercising, so you keep yourself active. How about your diet? Can you tell me a little bit more about what kind of food do you eat? Do you order? Do you make your own food?
I mostly make food at home. I just try to eat relatively healthy, avoid a lot of carbs and sweets,
Okay.
but no specific diet. Just healthy eating. I also try to not eat after 7 o'clock in the evening.
Oh, very good. Okay, well, I think we have concluded with the interviewing part of this visit. So if you don't mind, I'm gonna start the examination part. Okay.
Okay.
All right. Thank you. Put this with my hands. Okay, I would like to start with the skin examination. So do you mind if I touch you? I'm gonna have to. Okay, great. Thank you. Can you show me your hands like this? Okay, great. And turn them around. Good. Show me this. I'm going to be feeling your hands and looking at your skin. I'm not feeling any nodules, any lesions. Do you have any discomfort or pain?
No.
No. Okay. The skin is moist, warm. Okay. The capillary refill is less than 3 seconds. Nails are appropriate and there's some nail polish present. Do you mind doing this? Thank you. Not noticing any nail clubbing. That looks good. I'm going to proceed and examine your elbow and go up to your shoulder. Okay. Any discomfort here or pain?
No.
Okay. Great. Thank you. I'm going to be checking your pulses now. I'm going to be looking at the radial pulse first. Okay. It's about 80 beats. It feels pretty regular. And I'm going to do brachial pulse. It's about 80. If there were any irregularities, I would do a full minute of your pulse check. Okay. 80. 80. Perfect. Thank you. I would like to proceed and check your reflexes now. Okay. So for which I'm going to use the hammer. Thank you. So I'm going to start with your triceps. Thank you. Seems to be normal. Your biceps. Good. Okay. Brachioradialis. Excellent. And we're going to do it here. Just relax your arm, your triceps. Okay, thank you. Biceps. all normal. Thank you. All right, how are we doing so far?
Good.
Okay,
Good.
great. Thank you. I'm going to ask you to do some hand motions with me if you don't mind.
Okay.
Can you keep your hand like this and move them left and right, up and down, do it like this. Okay. Great, thank you. Thank you. All right, how about your elbows? Can you move your hands left and right? Appropriate range of motions. The next thing we're going to be checking are the shoulders. Can you put your arms over your head? Thank you. Down. And then put the hands behind your neck like this. And then like that. Okay. Any difficulties doing that or any pain?
No.
No. Okay, great. Thank you. The next thing I'm going to do is I'm going to ask you to close your eyes and turn your hands facing up. I'm going to be placing something in your left hand first and then in your right hand, okay?
Okay.
So I need you to recognize this. It's going to be a sternognosis test form. Can you?
This feels like a coin.
Very good, thank you. And now we're going to be testing your right hand. I'm going to be placing something in your right hand. Can you close your hand? Thank you.
This feels like a marble.
Excellent, thank you. That was a normal test. Thank you for doing that. I'm going to ask you now to touch your nose and touch my finger. One more time. And let's repeat that with your left hand. Excellent. Thank you very much. Everything looked good there. The last thing I'm going to do is check for your lymph nodes. I'm going to do your right here epitrochlear lymph node. I'm not feeling them. And then I'm going to go for your axillary lymph nodes. I'm sorry, I hope you're not ticklish. I'm going to apply just a little pressure there. And I'm not feeling any. Okay, good. Same thing here in the right arm. Epitrochlear. Not palpable. Axillary, not palpable. Great, thank you. I would like to move on now to check your head and face, if you don't mind. So I'm going to be examining your face now. So sorry, I'm going to be touching your face. I'm looking at the hair. It looks like evenly distributed. Are you coloring? Are you dyeing your hair?
Yes.
Okay. All right. Skin looks to be fine. No hyperpigmentation. I'm not noticing any lesions. Okay, very good. Can you frown? Okay, good, thank you. Can you puff your cheeks? This is a cranial nerve 7. And everything seems to be fine. The next thing I'm going to be doing is checking your sinuses, okay? Your frontal and your occipital sinuses. Okay, maxillary sinuses and frontal sinuses, okay. I'm going to be applying a little pressure there. Does that hurt?
No.
Okay, how about here?
No.
Okay, great. I'm going to be percussing them a little bit, okay? So, sorry about that, I feel a little pressure. Did that hurt?
No.
Okay, pressure here. This will be your maxillary sinuses. All right, everything seems to be fine there. The next thing I'm going to be doing is I'm going to be checking your temporal artery, okay?
Okay.
And now I'm going to be auscultating your temporal artery for any bruit. Okay, so I'm not noticing any lesions. I'm not noticing any hyperpigmentation. Everything seems to be fine. Okay, I would like to move on now and to start looking at your neck. Okay. I'm going to be checking your neck symmetry. That looks fine. Do you have any spots that are hurting? Any painful?
No.
No? Okay, good. All right, I'm looking at your trachea. Seems to be positioned evenly. Very good. The next thing I'm going to be doing is I'm going to be examining your lymph nodes, okay?
Okay.
I'm going to start with the back. This will be the occipital ones. Okay, and then we have the posterior auricular, preauricular, okay, submental, submandibular, tonsilary, okay, deep cervical, posterior cervical, supraclavicular. And I'm not noticing any abnormal findings there. I have to check your thyroid gland there, for which I have to approach you from your back.
Okay.
Okay. Okay. Okay. I'm gonna move your hair to the side. All right. This might feel a little bit uncomfortable. Please let me know if there's anything I can do for you. Okay.
Okay.
All right. Can you turn your head to the left? Take a. Can you just try to swallow? Thank you. And then turn your head the other way. Try to swallow. Okay, very good. Thyroid is not palpable, which is a normal finding. Okay. How are you doing so far?
Good.
Do you need to take a break or are you doing okay?
I'm good.
Okay, great. Thank you. I would like to proceed now and examine your ears. Okay? Okay, so I'm going to approach your left ear first. There's some earrings present. I'm going to apply a little pressure here. Any pain?
No.
No. Okay. I'm not noticing any lesions. I'm not seeing any visible discharges. Okay, the ear seems to be symmetrical. Everything seems to be okay. I will perform a test for which I'm going to use an otoscope. So I'm going to be checking the patency and look at the internal structure of the ear.
Okay.
Okay, thank you. Thank you. Okay. Well, I'm not noticing any abnormal findings there. I checked your external canal and your tympanic membrane, and they're appropriately pink color, and everything seems to be in the right order there. The next thing I'm going to do is I'm going to do a whisper test, which means I'm going to be checking your hearing on your left side and on your right side. Okay, so I'm going to tell you 3 things. Since I'm checking your left ear, I'm going to be covering your right ear. Okay.
Okay.
So you just repeat them after me. Lamp, water, blanket.
Lamp, water, blanket.
Good. Cup, bed, book.
Cup, bed, book.
Excellent. Very good. For the next part of the exam, I'm going to be using this fork that I'm going to be placing on top of your head. And please let me know if you can hear it at all, or if you can hear it in one ear versus the other ear, or both ears.
Okay. I hear it in both ears.
Very good. Thank you. Now I'm going to be placing this fork behind your ear, and I need to know if you can hear it. That's the first. And the second thing is when you stop hearing it, okay?
Okay.
After that, there will be a bone conduction. We'll be doing the ear conduction. I'll be placing it, the same fork next to your ear, and you're going to tell me when you stop hearing it again.
Okay. It stopped. Here.
Great, thank you. And that's appropriate because bone conduction is half the length of the air conduction. So you're going to be hearing much longer through the air.
Okay. It stopped. And it stopped.
Great. Thank you very much. All right. Well, your ears are fine. I'm not noticing any abnormal findings, and your hearing is well as well. Okay. We're going to proceed now and checking your nose.
Okay.
Okay. So I'm going to be palpating your nose, and then I will be using the otoscope to examine the internal structure of your nose. Okay.
Okay.
All right. So checking the bridge of the nose. It's symmetrical. Okay, the skin seems to be fine. I'm not noticing any lesions, any bumps, anything like that. Okay, I'm going to be testing the patency of the nostrils. Okay, so do you mind closing your one nostril and just breathing to the other? Excellent, thank you. And do you mind repeating the other one? Okay, great, thank you. I'm going to go ahead now and examine your nose. This might feel a little uncomfortable. You're going to need to look up and just kind of lay back a little bit. Thank you. Thank you. I'm sorry. All right. Well, I'm not seeing any discharges. I'm not seeing any bleeding or anything, any abnormal. So everything seems to be in the right order there. Okay. I would like to proceed now and check your mouth and your throat.
Okay.
Okay. Thank you. So for this exam, I'll use the otoscope as well.
Okay.
Okay. So do you mind if I just touch your face a little bit?
Sure.
No. Okay. Can you get the lips? Okay. Can you open your mouth? Okay. I'm going to be using a spatula. Can you pull your tongue out? Apply pressure. Can you say ah?
Ah.
Okay, move your lips moving. Looks fine. Can you move your tongue left and right? Okay, excellent. All right, how are we doing so far? Good. I'm going to be looking at teeth. This was we will be checking cranial nerve 12 with your tongue movements, and you did great. Can you press against my hand with your tongue? Excellent. Press over there. Okay, very good. And I'm going to be checking now your tonsils and your internal structures of your mouth.
Okay.
Okay. Thank you. Can you open your mouth? Okay, good. I'm not noticing any redness. Tongue seems to be fine. Can you lift your tongue up and touch the very good. Okay. Everything looks to be fine here. I'm not seeing any, just check your frenulum looks fine. Everything looks to be in the right order. The teeth are looking fine. Your gums, there's nothing to be concerned about. I'll be putting my gloves and manually checking your mouth now. Okay. Open mouth. Okay, good. All right, thank you so much for letting me do that. Do you need to take a break? Are you doing okay?
I'm fine.
Great. Thank you. The next thing that I would like to do is check your eyes.
Okay.
Okay. Do you have any issues with your vision?
No.
Okay. All right. And you never had glasses or anything like that?
No.
Okay, great. So I'm going to be looking at your glasses, at your eyes. I'm going to be filling in your eyebrows. Okay. Tear ducts. Okay, everything looks fine there. I'm not noticing any bumps. I don't see any styes or anything abnormal about it. So we're going to be doing the Hirschberg test first, which is the test. I'm going to be pointing the light between your eyes at the bridge of your nose, and I'm going to look at the eye reflection. Okay? Just look straight ahead. Very good. And that's normal. All right, very good. Thank you. Now we're going to do the 6 cardinal gaze signs. So this will be checking the cranial nerves 3, 4, and 6.
Okay.
So you can look at my pen. Okay, so follow it. Very good. That's normal. Okay. The next thing we're going to be doing is I'm going to be checking for accommodation. And so if you don't mind, use my pen again. Just focus on the pen. And I'm watching the pupillary responses, and they're constricting. So this is a proper accommodation. Now we're going to be doing a little bit more of an examination that will require me pointing some light at your pupils. Okay, observing your pupils. They're round, they are symmetrical, and they are seems to be aligned properly. So I'm going to be pointing some eye first at some light at your right eye, then in your left eye. Okay, just kind of look at me straight ahead. Okay, pupil is it looks appropriate response. It's brisk and it's constricting appropriately. I'm looking at your left eye now. Very good. And the pupillary response is again brisk and constricting and responding appropriately. Now I'm going to be pointing the light at your right eye, and I'm going to be observing your left eye.
Okay.
Very good. Symmetrical response. Same thing up here. Very good. Thank you so much for letting me do that. Okay. Now I will like to check your eye with the light again. We're going to be looking more at the internal structure of your eye. Okay. Thank you. Okay, the red reflex is there. I see the vessels, blood vessels, and the optical disc. Thank you. Let's do the same thing here. Red reflex, blood vessels, cornea, and the optical disc. Okay, I'm not seeing any abnormalities. Everything seems to be fine.
Okay.
Okay, how are we doing so far?
Great.
Okay, thank you. I was looking at your iris, your conjunctiva. Everything looks fine. I'm not noticing anything unusual about your eyes. Okay. I think I would like to test your short-term and the long-term memory at this point.
Okay.
So I'm going to tell you 3 things that you're going to be repeating to me at the end of this examination. Okay. All right, great. So let's do bear, lamp, bottle.
Okay.
Okay. And now to test your long-term memory, I'm going to ask you the former presidents, so not counting the current one, who was the president before and the one before him.
Donald Trump, Barack Obama.
Very good. Excellent. And now we're going to proceed and start looking at your lungs and your chest, okay? Okay, so for which I'm going to approach you from your back, if you don't mind.
Okay.
Okay, thank you. I'm gonna move you over here. Okay, great. Can I lift this up? I have to be observing your skin.
Yes.
Thank you. Okay, thank you. Your back seems to be symmetrical. The skin is appropriate. I'm not noticing any hyperpigmentation. Okay. The AP versus the thoracic one is 2:1, and that's the appropriate size. I'm going to be just gently palpating your back. Any pain, any abnormalities here?
No.
No. Okay. You just keep on taking nice and deep breaths. Okay, checking for tremors. Everything seems to be fine. Okay, take a nice deep breath. Okay, very good. Expansion seems to be fine. Okay, excellent. Now I'm going to be percussing. Okay, I'm going to be auscultating your breath sounds now. You mind saying ah? Okay, the Goffin test is fine. Okay, great. How are we doing so far?
Great, thanks.
Okay, you're welcome. All right, well, I think we are we're fine here. You can cover it. Thank you so much. I will have to examine you at the front. Okay. So I just need you to either lift or open up your. Yeah, thank you. Okay, so your skin seems to be fine. I'm not noticing any lesions. Your chest is symmetrical. I'm going to be just gently touching your chest. Does this hurt?
No.
No, okay, good. Everything looks fine. I'm going to be just listening to your breath sounds now, okay?
Okay.
Thank you. Deep breath in and out. Okay, one time. One time. Great. Thank you very much. I would like to listen to your lateral breath sounds now as well. So
Okay.
if you don't mind, I will put my stethoscope under your blouse. Deep breaths. Thank you. Great. Thank you. All right. I think we're doing fine there. I would like to, move ahead and continue examining you. But before that, I would like to just consult the list that I have here. Just give me a quick minute. Okay, that looks good. Okay, tenderness. Okay. Okay, so I will be testing a CVA tenderness for you. That's for your kidneys.
Okay.
So I'm going to be going behind you again, and I will just place my hand and gently pass over it. Have any pain?
No.
Okay. Any pain here?
No.
Okay, good. And then I'm going to be checking the TMJ. Any pain?
No.
Okay, great. And now I'm going to be palpating your carotid arteries. Very good. And I'm going to be using to auscultate your carotid arteries, okay? All right, normal findings there. Excellent. Okay, the next exam, part of the exam will be your abdominal exam, okay? So I'm going to ask you to lay down. And I'm going to be observing you taking just normal breaths in and out. Okay, good. That looks fine. I'm not noticing anything abnormal. Okay, I'm going to be lifting your shirt a little bit. I'm looking at the skin and your umbilicus, your belly button. Okay, the skin seems to be fine. I am palpating. I'm not seeing any lesions, any bumps. Do you have any discomfort, any pain?
No.
No. Okay, great. And I will be, can you mind like lifting your head up? Okay, good. I'm not noticing any bumps, any elevations, thank you. Was that painful or discomfort to do that? No, okay, great. The next thing I'm going to do is I'm going to be listening to your bowel sounds.
Okay.
So just keep on taking nice normal breaths. Okay, they seem to be fine. And now I'm going to be listening to a vascular accesses that we have here.
Okay.
The first one would be the aortic one. Okay, and then it will be renal. And then would be iliac. And then hepatic. And then splenic. Great. If you don't mind, I'm going to be filling your femoral arteries now, okay?
Okay.
Good. I'm going to be listening for the cry. Okay. And I'm going to be filling your inguinal lymph nodes. Any pain or discomfort here?
No.
Any pain or discomfort here?
No.
Okay, great. Thank you. We'll be just checking how we're doing with the time. We're doing great with the time. Okay. Your skin seems to be fine. Everything looks to be okay. I would like to go ahead and start percussing your abdomen. Okay, so you might feel just a little discomfort, but it should be okay.
Okay.
Yeah, everything seems to be fine. I'm not noticing any abnormalities. The next thing I'm going to be doing is a scratch test. So I'm going to be applying a little gentle pressure on your side under your coastal region, right rib cage. And this is to measure the size of your liver.
Okay.
It's about here. And your liver is to be just about 2 centimeters out. So that's a normal finding, okay? The next thing I'm going to be doing is I'm going to be filling your liver, okay? And I might not be able to feel it, but I will put one hand, under your right side, and you can take a nice and deep breath. Okay, great, thank you. So able to find just a little bit of it, and now I'm doing the spleen test. Okay, same thing, nice and deep breath. Okay, I was not able to palpate your spleen, which is a normal finding, okay? The next thing that I would like to do now is proceed and do your heart examination, okay? For which I will be using my stethoscope and examining your heart, okay? Before I do that, I would like to find your PMI, which is the point in your chest where you have the most palpable heartbeats, okay? So I'm sorry about that. I'm going to be applying some pressure under your left breast. This is usually about the 5th intercostal clavicular. Yeah, and now I'm going to be auscultating it. Yeah, about 80 beats per minute. And if this was irregular, I'll be listening to it for the whole minute, but it seems to be fine. Okay, now there are 5 points on your chest that I'm going to be listening first with the diaphragm, and then with the bell part of my stethoscope. Okay. Thank you. You just have to keep on taking nice and deep breaths. And this is the aortic one, that it's on S, that it's on intercostal 2 on the right sternal border. Pulmonic is also intercostal too, but it's on the left sternal border. Hips point is the third intercostal on the left sternal border. Tricupspital is on the fourth intercostal left sternal border. And then the mitral, is on the fifth intercostal midclavicular. Now I'm going to repeat this again. Second intercostal, right sternal border. And this was aortic, this was pulmonic. Second intercostal, left sternal border. Hips point, third intercostal, left sternal border. Tricuspital, fourth intercostal, left sternal border. And mitral, fifth intercostal, midclavicular. Thank you. How was that?
Great.
Okay, great. Thank you. I'm not noticing anything unusual. The heart sounds S1, S2 was. I heard I didn't hear any murmur or anything abnormal about your heart. Okay. I would like to proceed now and check your lower extremities.
Okay.
Okay. So I'm going to be doing that by observing your legs. They're symmetrical. I'm looking at the skin. I'm not noticing any lesions. I'm not feeling any bumps. Okay. Can you move your feet back and forth? Okay, good. Okay, great. Good. Apply pressure against my hands. Lift your feet up. Great. Can you bend your knee, and then with your heel just try touching yourself from your ankle up to the knee, up and down. Okay, perfect. And can you do the same thing with your right? Okay. Great. Thank you. And do you mind sitting up? I'm going to be continuing examining. If you can just maybe dangle your feet like that, just like that. Perfect.
Okay.
Thank you. Okay. So I will be examining the reflexes. Okay, I'm going to do the patellar reflex. Right and left. Okay, Achilles. Just relax your foot. Perfect. Good. Right one. Alright, I'll react really well. Okay, great. Now we're going to do a Babinski sign. It's going to be a little uncomfortable. I apologize about that. Okay, good. Right foot. Okay, great. Thank you. All right. Now I will continue examining your knee, your lower extremity. Okay.
Mm-hmm.
So we are going to be checking first to see how is your ACL.
Okay.
Okay. So I'm going to try to maneuver a little bit, okay?
Mm-hmm.
Any pain or discomfort? This is your painful knee? No?
Mm-hmm.
Not right now. Okay, great. Let's do it over here. How did that feel?
Fine.
Fine? Okay. I'm going to be doing the anterior pull test, the posterior one, anterior, posterior. Apples doesn't will apply a little pressure. Okay, and extension. I'm not hearing anything. I'm not seeing any movements, any pain.
Okay.
No. All right. Okay, good. And now for this test, I'm going to maneuver your knee a little bit. We're going to go with Horn's test. We're going to do a little and just relax your knee. And now we're going to be doing like this. Externally like that. Okay. We're checking your meniscus. Okay. Okay. Good. How'd that go?
Fine.
All right. Great. Well, you did great there, and I would like to test your hips now. Do you mind laying back again?
Okay.
think the easiest thing would be to, okay, can you flex your knee and bring it to your chest? Okay, great. Can you push against me? Okay, great. That's your strength. Can you flex your knee the same way and push against me? Okay, good. Excellent. Alright, can you bring both of your knees up? Okay, great. Thank you. And now we're going to do the high kick with your knee flexed like that. Okay, good. And let's do the same thing over here. Okay. How did that feel?
Fine.
Fine, no issues? Okay. Can you cross your legs? Okay, good. Can you try putting your leg back, resisting me a little bit this way? Okay, good. Over here, let's try coming back this way. Excellent. Thank you. I can go back up. Okay. I'll give you a minute. The next part of the examination would be you walking a little bit, okay? So just stand up. Now heel to toe, can you make a couple of steps? Okay, good. And can you come back? Good. Can you walk on your heels and come back and work on your tiptoes? Okay, good. Can you do a shallow, like a knee bend? Okay, good. And then close your eyes and put your hands in front of your arms. This will be a Romberg test. Okay, good. That seems to be fine. Okay, and now I'm going to be examining your spine. Your lateral view looks fine. From the posterior view looks good. I'm going to ask you to just bend forward a little bit. Yeah, I'm not noticing any scoliosis or kyphosis. Everything seems to be in right order. Your glute muscles look to be fine. I think you're doing great there. We're going to do a little range of motions for your spine. Can you just go left, right, forward, backward? Okay, great. Do you have any questions for me?
No.
Okay. Well, I want to thank you for your time, and I'm going to need a little time to finish my documentations. I'll get back to you.